I'm Dr. Walter Rocca from the Division of Epidemiology in the Department of Health Sciences Research and in the Department of Neurology here at Mayo Clinic in Rochester, Minnesota. I am going to briefly discuss and describe a paper that was published in the Mayo Clinic Proceedings pertaining to the history of the Rochester Epidemiology Project. The Rochester Epidemiology Project maintains and develops a medical record linkage system serving all of the people living in Olmsted County in southeastern Minnesota. Olmsted County is the county where the city of Rochester is located, and therefore is where the Mayo Clinic is located. All of the care providers in Olmsted County have agreed to share their medical information for research. Thus, all data generated as part of routine medical care are linked within each institution, and more exceptionally, they are linked across institutions. Thus, we can combine or paste together the complete medical biography of each resident in the county from birth to death, or from the time they move into the county to the time they move out of the county. The record linkage system includes all ages, both men and women, and we have approximately the same amount of men and women living in this county, all types of insurance coverage, and it involves outpatient care, inpatient care, and all levels of care from primary to specialist to subspecialist. The record linkage system has existed for almost 50 years, and it has been used to study almost all medical conditions, and so it has supported more than 2,000 publications. The paper published in the Mayo Clinic Proceeding provides a brief history of this unique project, the record linkage system, and it includes all of the key events and the key participants, the protagonists in the development of this research infrastructure. From the early 1900 to 1966, there was a preparatory phase which was related to the development of medical records and of disease coding systems at the Mayo Clinic. However, beginning in 1966, the Rochester Epidemiology Project was formally established and received funding from the National Institutes of Health. And so beginning in 1966, the medical record system was expanded from the Mayo Clinic to the Olmsted Medical Center, to several other general practitioners and to other care providers that were located in the county or around the county. And therefore, officially, the record linkage system has existed since 1966. The founder was Dr. Leonard T. Kurland, who at the time was chairing the Department of Health Sciences Research. The paper also provides a more recent historical update dealing with issues, for example, of confidentiality and data security, issues of the introduction of electronic medical records progressively to replace the paper records, and also changes in disease coding system which have taken place in recent years. The final part of the paper provides a brief outline of the plans for the immediate future, and the plans for the immediate future include the expansion of the coverage of the record linkage system to an 11-county region in southeastern Minnesota. This expansion would allow us to move from approximately 140,000 subjects to almost 500,000 subjects that would be covered by the system. In summary, the Rochester Epidemiology Project is a unique research infrastructure. It has played a major role in medical research and in public health research, and we expect that the system will become even more valuable in the coming year because of the expansion to a larger population and because of the increasing interest in linking medical information across multiple care providers in order to be able to study long-term outcomes and effect of medical interventions. Thank you.
We hope you benefited from this presentation based on the content of Mayo Clinic proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.